We're going to visit Dr. Allan Spiegel at the National Hyperbaric Oxygen Therapy Center. We'll discuss using pressurized concentrated oxygen in treating children with autism as well as people with severe brain injuries.
Hyperbaric oxygen therapy is a form of treatment that we want to make the public aware of. By introducing 100% concentrated oxygen under pressure, HBOT can be used in treating a wide range of medical conditions.
Well, why don't you explain to the viewers what exactly a hyperbaric oxygen therapy is?
Hyperbaric oxygen therapy is an FDA-approved treatment in which you're breathing 100% oxygen under increased pressure. You and I are breathing room air, which is 20% oxygen, but in this environment we use 100% oxygen and increase the pressure.
And what is the, I know when most people think of hyperbaric chambers, they think of divers with the bends, but from what I've read and what you've told me, it's multifaceted, some of the applications, such as autism. I know it can be used for that. What is sort of some of the science behind it?
The hyperbaric therapy is a treatment that when you're breathing oxygen under pressure, you increase the amount of oxygen that saturates every part of the body to anywhere from 8 to 10 times more than is currently present. That turns oxygen into a drug. Oxygen as a drug does several things. Causes new blood vessels to go into any part of the body that's not getting adequate blood perfusion. Increases the function of the white blood cells that help gobble up dead tissue, lay down the framework for healing. It enhances the immune system.
And tell us about one of the case studies that you were discussing off camera regarding some pretty remarkable results that you had with HBOT.
One is a sheriff from Pasco County, one of the counties just north of us here, who went to Iraq in 2005 in Fallujah, the major battle where we had a lot of unfortunate casualties. He was struck with an IED blast which took out the front third of his brain. So both frontal lobes and half of both temporal lobes were destroyed. Obviously he survived. He was under the VA's care for 5 solid years. They did what they could to help him. But he was unable to speak more than a handful of words, unable to move the left arm and leg, totally wheelchair bound for 5 years. Referred to us, we started treating him. Within a week to 10 days, his speech improved by approximately 80%. By the end of the second or third week, he started moving the left arm and leg more. And by the end of the month, he was moving enough that we could actually get him to stand with maximum assistance of me and my associates. Make a long story short, we then had physical therapy, and today he walks without a cane, full strength, both arm and leg. Speech is phenomenal. He's got his life back.
Now, how does this work on, say, stroke victims?
Interesting. When I talk about stroke and hyperbaric, I relate it to what the most common use of hyperbaric is, which is wound care. People who have a wound in their leg usually have the wound because of poor healing. You're not getting enough nutrition into the area of the wound to heal it, to lay down the framework for healing and circulation, etc.
Now, some people, just to play devil's advocate, of course, some people are probably watching this thinking, this sounds like a magic bullet. It can fix anything. I'm sure it can't fix everything. And there also is, you'll probably admit, a lot that isn't even known about why it works. It just does, right?
Exactly. I mean, the number of things and disorders that it treats is enormous. In Russia, 75 different diagnoses are approved in Russia. In the United States, it's 14.
Why are they pressurized?
When you're breathing oxygen under pressure, you're increasing the amount of oxygen that saturates every part of the body. Matter of fact, they did actually an interesting study they did many years ago. We all know, because we grew up in grade school and we were told that you need hemoglobin to carry the oxygen molecule all around the whole body to nurture all our tissues. They did a study where they took out the hemoglobin from an animal, test animal, and they had them in a chamber just with normal fluid, the normal serum that's in the blood, and they did fine because you're not using the hemoglobin. You're going beyond that to saturate every part of the body.
I mean, obviously, people don't always come in with the same set of symptoms when they come to you. What is is there a typical treatment plan? Is it better to do consecutive days? Is it How do you work out that treatment plan?
It depends on what we're treating, number one. Non-healing wound could be 40 treatments. Traumatic brain injury could be 20 to 40 treatments. There's some that are a lot less. Like I've treated people with pain in the bladder or rectal area if they've had radiation therapy that no other medication or therapy would work. And in 10 treatments, I get them out of pain.
Well, it's very interesting. I know we're going to take a look next door
And meet some of the patients.
at some of the chambers. And on a personal note, a lot of the reason why I wanted to meet with Dr. Spiegel is I read about its effectiveness with autism, and I understand we're going to talk to the mother and the son, who's 16 years old, that has autism.
He's doing outstanding.
Yeah.
He's doing outstanding.
Yeah, so we're going to talk to them. And there was another woman named Alex who was actually pronounced dead through cardiac arrest.
Right.
And she's seen some pretty remarkable results as well. So we're going to talk to them.
In what, four treatments?
Just 4 treatments so far.
Unbelievable.
I'm Patty. This is my son, Johnathan. He was diagnosed with autism at 2.5. He had no language, and his behavior was, when he got very angry and frustrated, he would take his head and bang it into the floor and walls, and so it was very hard. There's a lot of behavior that you deal with. We've been with the doctor since he was 4. We've been doing their protocol. We've been doing clay baths to pull metals out. We've been doing ancient mineral baths, which is almost like a Schwarzenegger Epsom salts. I did RDI, which is research development with autism. I did some of that. I used to do ABA with him. Discrete trial training, I learned that. I did that. Just as much as I could get my hands on and afford to do are the things that I've done with Johnathan. Hyperbaric is a newer therapy that we've done, which is yielding in amazing results. We came here in January and we've done 20 treatments. More social, being able to think more outside of the box, more of instead of a limited ability to be able to talk and think more, just able to think about more things and discuss more things.
The Hyperbaric has given me more courage to talk with people. To tell the truth, when I've been younger, I was more kind of shy to talk to people because I was thinking the way I talk to people go, oh, he can't speak well, he's this and that. That's what kind of person I've been. But the Hyperbaric has given me more courage to talk with people. That's why I've been so silent.
Well, what happened to Alex was a year ago, February 19th, she was at home in her condo and she had a cardiac arrest and a seizure. And thankfully, she was talking to someone on the phone when it happened and they were able to get to her, but she had already passed away by the time they got there. And they called 911 and they started pressing on her chest and waited for 911, and they took her to the Tampa General Hospital. They paddled her heart and got her back in the ambulance. And when we got to the hospital, they had the chaplain greet us, and they said that they didn't think that she was going to survive. And they incubated her, and we waited all night long, and they heavily sedated her, and she was in the hospital for 2 months. She woke up after about 4 days, which is a good sign. That means that she wasn't without oxygen too long to where she couldn't recover. They gave her a 50-50 chance. Well, at the hospital, after 2 months, they put her in now. They're in care inpatient rehabilitative services, and they had speech therapy, physical therapy, occupational therapy, because she couldn't walk or talk for 2 months, and she was totally in bed. And so by the time they would have to get her in an egg, what they call an egg, to lift her out and put her in a chair. When we first started sitting her up in a chair, where she couldn't even hold her. Couldn't sit up either. So she went from all of those things, not talking, not sitting, not walking, to where she is today. And we're still in physical therapy and we're still in speech therapy. But I started investigating other treatments that would maybe help her brain recover faster. Because really what it is the brain has to correct it, has to really heal itself, and they have no idea what the brain is able to do. So she's had 4 treatments so far, And the actually second day, I saw an improvement in her communication skills and euphoria. She was much happier. She wasn't sad and depressed. She has more facial expression, and she can carry on conversations with you, which she was not doing. She was just using two or three words at a time to make a sentence, you know. So it's really been, I think, a quick recovery in those short days. I wasn't expecting that. I think she'll be able to come all the way back as far as her progress. I really do. I think I'm looking forward to the 20 treatments at least. And then we'll see what Dr. Spiegel thinks. But I really believe that Alex is going to recover. And I believe this oxygen treatment is the answer to it.
Give everything you see a chance.